Hi, my name is Serena, and I am here to argue the negative that the United States should not adopt a nationalized universal healthcare system. My opponent made a lot of really good points that the US healthcare system has serious problems. Medical debt is crushing families, people are canceling doctor's appointments because they can't afford the bill, chronic illness persists untreated, and the life expectancy here is lower than almost every other developed country. There needs to be a fix. My opponent concludes the solution is fully nationalizing healthcare. While this may sound good in theory, it has been tried and it's not as glamorous as it appears. There is a better way. My opponent is correct in pointing out that over 50% of Americans have faced medical debt. People have to skip the dentist, therapist, or needed specialized treatment because they're scared of the bill. This connects to bigger problems, including the mental health crisis, drug addiction, homelessness, which is all an impossible cycle. While I'd also agree that prescription prices are too high, including insulin and blood pressure medication, which should not be considered luxuries, nor should they be rationed because they're unaffordable. We agree on this, and there is need for reform. However, I disagree that government-free healthcare is the right solution, and I'd like to point out some caveats. Other countries have tried this, and it's a lot more complicated than it looks. My opponent pointed to Canada and Nordic countries as proof that a universal healthcare works. While these countries have lower purchasing costs, higher vaccination rates, and strong preventative care, wait times are essential to consider. In Canada, the median wait time to see your family doctor between seeing your family doctor and actually getting the treatment referred to is almost 7 months. Over 1 million Canadians are on wait lists at any given time, and in the UK, which has fully nationalized services, there are currently 7 million people on wait lists out of a country with 67 million people. These months of waiting are incredibly detrimental considering needed treatments like cancer screenings, joint replacements, cardiac procedures. My opponent acknowledged that there would be an initial influx of patients, but said that this would taper off. But when thinking about the reality of the 335 million people in the United States, millions who've been putting off this healthcare for years because of the cost, that would mean that when the universal healthcare kicks in, trying to treat all these people, considering the current doctor shortage, is a recipe for disaster. Nordic countries also have something else working in their favor. They're much smaller, more homogenous, and they have different tax cultures and structures, and even they may struggle to maintain healthcare rates. Denmark has only 6 million people and Sweden has 10 million people, while the US has 335 million people spread across 50 states, with vastly different economies and needs. Using a system that works well in a small, wealthy Scandinavian country and trying to apply that directly to the US will not play out smoothly. Also, the cost doesn't add up the way that it is sometimes described. There is a claim that $615 billion is what Americans spend on medical debt every year, and that would be freed up under a universal healthcare system towards money for groceries, housing, etc. And this all sounds great, but who actually pays for this system? Congressional Budget Office found it would cost $1.5 to $3 trillion in additional in federal spending every single year than we currently spend. We already spend around $988 billion in Medicare as of last year, and Medicare's trust fund is projected to run out by 2040. That money must come from somewhere, and it will consequently be from the pockets of taxpayers. This is a significant burden on working Americans. My opponent also acknowledged that yes, taxes would go up, but you'd save on medical debt. But the thing is that saving $1,800 a year on average in medical debt while still paying thousands of dollars more in taxes is a further net loss. And making it free doesn't solve the actual problems. The thing that I came back to is the problems my opponent identified, including the mental health crisis, drug addiction, homelessness, and chronic disease, aren't just problems of access. They're also problems of funding, staffing, infrastructure, and prevention. Making healthcare free doesn't automatically build more mental health clinics, hire more therapists or primary care providers. Pouring an influx of new patients into an already strained system will completely overwhelm healthcare providers. Considering the COVID-19 pandemic, when there's a high demand and short supply, this left people without proper care. Currently, doctors and nurses are already burned out, with 43.5% physicians reporting burnout in the US. The system needs more capacity, not more demand. There is a better solution. We do need serious reform, and so there should be targeted action taken. I think we should expand Medicaid. There are still states that have not accepted Medicaid expansion, and this would immediately cover millions of low-income Americans at a much lower federal cost than a complete revamp of the national system. If you let Medicare providers negotiate prescription drug prices, this could bring down costs without dismantling the entire system. Additionally, an increase in funding should go towards community health centers and mental health services. Furthermore, hospitals should be required to give complete price transparency so that patients are not hit with surprise bills. While all of this might not sound as glamorous as free healthcare for everyone, it would address the specific issues without adding trillions of dollars to the federal debt and potentially deadly wait times. There are much better methods of reform, but free healthcare is not one of them because it simply does not work. Once again, fully nationalizing healthcare has been tried in other countries and the results are mixed, including long wait times, strained systems, and cost structures that don't translate well to a country the size of the US. We can do better for Americans without going all the way to free nationalized healthcare. Expand what is working and fix what's not. Thank you.